Welcome to the Mary Mac Show, where we will be talking about your feelings, experiences, and pain following the death of a loved one. Hello, everyone. This is Mary Mac of the Mary Mac Show, and I am privileged today to have a wonderful woman who has endured immense sorrow, immense pain with the death of her young son. Luka was 7 years old when he was diagnosed with cancer, and he died at the age of 11. What I am doing with this series, and this series is for bereaved mothers who have lost children at all ages. And today we speak with CarolAnn as the section for the death of a young child. So Carol, I am so pleased that you are with us. You are from Franklin, Wisconsin, and she is married to Bob. And she has two other daughters who their names are Mara. Is that correct? And
Mara and
Nina. And when Mara was 17 and Nina was 15, Luka passed on. We also have an author here. So she's written a wonderful book called Luka's Light, and we'll introduce that to you at the end of our conversation. But I'd like to introduce CarolAnn and thank her for being on here today. And thank you very much.
Thank you. Thank you for the opportunity to share our story. Luka was a very special kid, as all parents think their children are. But I think we had a little extra special kiddo that we were only given for 11 years, but we sure made the most of it. So you want me should I just start?
Yes, yes, please tell us about life before Luka passed on, or before even that he was diagnosed. How was your family life and everything moving forward, and never a care?
Yeah, we were a pretty typical family of five, two girls, and then Luka was the baby, an only boy and the baby. So he's a little spoiled probably, but we were very, very typical, busy with sports. Luka and Mara both played soccer. Nina, not as much of an athlete, but she ended up finding swim and loved to do that. Keeping busy with school things. We were part of we are Croatian, and so we have a very big Croatian community that we are part of. So the girls, Bob and I actually both are Croatian, and we met at our church when we were small kids. So we have a long history together ourselves. So the girls, girls participated in a cultural music and dance group. So we were always busy with that. Luka ended up having a year with them. We were typical, I would say very, very typical. And up until Luka was sick, we didn't have too many cares. Like you said, we were going along, we thought, quite nicely. And our faith was also, I should say that, our step back and say our faith was also a big part of our life. We both raised Catholic. We raised our children Catholic, went to school or went to church weekly, and thought we had a good relationship with God and a good trust in what He was doing with our life until tragedy hit. And then that shook things up a little bit.
Yes, usually does, doesn't it?
Yes,
Especially
yes,
it shakes
sure.
up your faith.
Oh, for sure. Yeah. And then another part of our story is that Luka, before he was born, so we had Mara and Nina. When Nina was about 2.5, I got pregnant again. And this was before Luka.
Okay.
So I ended up having a miscarriage. So before Luka was sick, this was probably our first little hiccup.
Okay.
At 16 weeks, third baby, I thought, I wasn't worried about it. I was feeling good and had no cares. Bob actually had a meeting and couldn't come with me to an appointment, but I, again, thought, third pregnancy, I'm going to go to this appointment and it'll all be fine. But it wasn't. I was having an ultrasound, or actually just looking for the heartbeat, not even an ultrasound, and there was no heartbeat to be found. So then we had an ultrasound, and it confirmed that the baby had died in your utero. We don't know why. There was no reason, but I was too far enough along that it wasn't just a typical, I guess, miscarriage. I had to deliver the baby,
Right.
and we found out that it was a boy. So we went in, delivered our son, got to see him, hold him, and then had to leave without him. And so I thought at that point that was going to be the hardest thing that I'd ever have to do.
Right.
And sadly, it wasn't. So then the next year, we did get pregnant again. Luka was born the following year. So that it was a little bit of, I think, foreshadowing. When these type of things happen, you always wonder why. You want the reason. You look for answers,
Sure.
but we often don't get them. And we don't, especially this side of heaven, right? We don't
No.
we don't always get to know why things happen the way they do. But I feel like that I learned later that there was a purpose for that little boy, that the fact that I knew it was a boy. So when Luka was, a little side story with that, when Luka was about 2 years old, this kid was a precocious talker. He for 2 years old, he actually had barely any teeth. He got his teeth very late, but talked up a storm. And the girls were starting school and they were getting on the bus to go to school. And he, of course, as younger siblings always want to do, they want to get on the bus and go to school too. So he had this thing with the bus, right? So he took a nap one afternoon when the girls were at school, and he woke up and he was telling me, "Mom, my brother was on the bus." And I said, "Your brother was on the bus?" And he said, "Yeah." And he said it was time to get off. He's telling me this in his 2-year-old words, but it was very clear. So I told him, "It's time to get off. We're home." And he said, "I can't get off." The brother told me he had to stay on the bus.
Wow.
So I immediately was like, "Oh boy, he's meeting his brother." And of course he was 2. We never told him that we had miscarried and had, that he had a brother in heaven. I mean, you don't tell those things to a 2-year-old,
Right.
but I right away just got the chills and thought, "Oh my goodness, his brother came and played with him in his nap," and this happened more than once. It happened a couple times over a period of some weeks. So I thought that was kind of a cool thing, but a little, I just thought it was sweet that he had a guardian angel
At the time.
At the time.
Yes.
Yeah. So then when Luka got sick, that unfortunately was one of the first things that came into my head as I was sitting in the waiting room when we had first found out and we were meeting with a neurologist. My mom was sitting with me because Bob, unfortunately, again, was out of town for work, and he doesn't even travel that much, but it always just seemed to happen that when we had these crazy things happen, the poor guy had to drive home from somewhere with bad news. So anyway, the day that Luka was diagnosed, Bob was about 2.5 hours away for work, and my mom was sitting with me, and as we were waiting for him to come in for our meeting, I had a flashback of that little encounter that Luka had with his brother. And I was thinking, oh no, oh no. I wanted to convince myself that it was a good thing, that his brother was going to be his guardian angel and everything was going to be okay and things were going to work out. But I think right away on that day, I think I had a pit in my stomach that was telling me otherwise, that maybe that little brother was there to be somebody that he would know when he went to heaven. So I that was a crazy little I don't know if it was foreshadowing or just crazy little story, part of our story. But um that was just, I don't know, I like I said, I tried to push that down deep and not pretend that it was that I was having the bad thoughts, and just going with the fact that maybe this was going to be a guardian angel for Luka. So would you like me to talk a little bit about how he was diagnosed, or how we found out?
Yes. Would you tell us the story of of what he went through with the illness, and how brave he was going through all of this? Because this was like a 4-year event of him being ill. Okay.
Yes. Yep. So right after his 7th birthday, his birthday is in May, and at the very beginning of June, after he turned 7, we thought he just had a virus. We thought he maybe had a sinus infection or an ear infection, something, because he was very congested and he would vomit in the morning, but then he would feel fine. And so it was about a week and a half of this. We took him into the pediatrician. They said, yeah, it's probably just a virus. Then the next weekend in between, he was really sick, like vomiting a lot, not able to keep anything down. So my husband took him into urgent care, and they said, yeah, it's probably all, again, just part of this virus. They actually gave him some Zofran to stop the vomiting. And it helped, got a little bit better. But then by the next week, one day, this is when Bob left for out of town. Luka he even said, I feel bad leaving. And I said, he'll be fine. He woke up, he was feeling, he was better yesterday, went to school. He's going to be fine. Well, Bob left and Luka woke up for school that morning, and right away, like, something wasn't right. And then all of a sudden he was just crying and said, my head really hurts. It hurts bad. He threw up again. So I took him back to the pediatrician, and the doctor, when she looked at him, I think she knew. So at this point, with, like, again, about a week and a half time, it was very quick, the whole turnaround of this. He had, like, you could almost see a little bit of a droop on the right side of his face. Wow. Okay. And it wasn't so profound, like you would think in a, as you see somebody with a stroke or something, but I thought, it was just more puffiness or congestion, because it wasn't that much. And you're not going there yet, as a mom. Right. I was, always worried, but I wasn't thinking anything more than this is just still a bad virus. But right. The pediatrician kind of looked, and I could tell she was like, she actually said maybe it's Bell's palsy, something like that. That in that, again, you only hear that, or you mostly hear that in grownups, right? You don't.
Yes, exactly. I've never known a child. Yeah.
Right. So she said, we don't want to diagnose this in the office. Just to rule everything out, I'm going to send you to Children's Hospital for an MRI. And so I was thinking, okay, that seems a little extreme. Like she did, but I thought, well, of course, we want to rule everything out and deal with what we need to deal with. I was thinking maybe it was going to be an invasive sinus procedure or something, that's still the most that I was going for. But she didn't even have us go home. She called and made the appointment right away for us and had us go directly to Children's. So she knew, her gut told her
something wasn't right.
Something wasn't right. So we went off to Children's, and he had an MRI right that day. And sure enough, they found a fairly large mass, like right butted up against his brainstem. So it was called posterior fossa ependymoma. Fancy.
Wow. For you to be able to say all of that, right?
Ugh. Yeah. Never wanted to know that word. Never wanted to hear that word. But yeah, it was a nasty cancer, a nasty tumor that we would learn didn't respond well to chemo. The best bet for the best prognosis was if you could have a full resection, total resection of the tumor. And because of the location of Luka's, we knew that wasn't going to happen. If they were to aggressively remove the whole tumor, Luka, as we knew him, would not be the same. So his quality of life would be gone. So meaning it was affecting cranial nerves that it being so close to the brainstem, he likely would not have been able to eat. He wouldn't have been able to swallow on his own. Those are, the basic functions
everyday life.
Would be affected. Yeah. So as it was, the first major resection, he lost hearing in the right ear, total, because that nerve was severed. His eye didn't move past his right eye didn't move past center any longer, and he couldn't fully close it. Also lost the ability to tear. So his eye was sort of, in a little jeopardy. We did have issues later down the road as well, because it couldn't protect itself. Essentially, if something was in his eye, he couldn't feel it. And then his eye didn't tear to naturally dispel of whatever the little, dust or object would be. So it was a mess. We didn't know it at first, but would come to be another little thing.
Was he able to blink? I mean, could he use?
He did blink, but it didn't fully close. Gotcha. So it wasn't a full, even when he slept, we ended up later on having to tape his eye closed every night because it stayed open. And so then that just would dry out. And then if any dust, just any particles that would come into his eye, it wouldn't expel it naturally. And it would irritate his cornea eventually. So we learned later, and I don't even think our doctors realized, it was such a strange little side effect that I don't even think our doctors knew to look for that at first until we had some issues with his eye and the cornea becoming infected. So that ended up to be sort of a little pain in the butt that we had to worry about along the way. Also, he lost the right vocal cord was paralyzed. So that not only affected, he still could speak. Luckily, he still had enough closure that he could produce his voice, and sometimes maybe you'd be a little bit more raspy, a little bit, not as strong. But the main problem with the vocal cord being paralyzed was also that it affected his swallow, because you need the vocal cords folds to close properly to get a safe swallow. So in the beginning, after the first surgery, he couldn't have liquids for a little while. And he actually ended up with a nasogastric feeding tube because he just wasn't strong enough to eat safely. So that luckily did get better after the first surgery. And he had an injection in that vocal cord to plump it up. It was basically like a collagen injection to plump it up so he could achieve closure to safely swallow. So he had a little bit of speech therapy to work on the swallowing, and we had to use these little methods where he had to turn his head to the side and make sure he chewed real carefully and cleared all his swallows. And so he did go through some rehab in the beginning there, but we were so grateful that wasn't a long-term problem. When I say long-term, meaning the next 4 years, that he could still eat and enjoy food and drink without having to thicken everything and change up his diet too much. So even though we had he did end up with, some pretty good deficits, he was able to compensate for so much of it. And we were so fortunate that his body responded well to everything we did to help him through these, the little obstacles. That made such a difference. We were able to still, like I said, I think we had to decide early on that we wanted to preserve the quality of life.
Yeah.
So instead of just saying, take it all out and not knowing how that would leave Luka, we wanted to give him as much time that he could still enjoy things, that the girls could still enjoy their brother, that he could still do what he's supposed to do as a 7-year-old boy. So our surgeon was excellent and was very, shared very honestly with us that he felt that was important, and he felt that each surgery that he would end up doing, he would be as aggressive as he could while preserving as much quality of life as he could for Luka. So we were very thankful for that, and we had a really awesome neurosurgeon. I can't say enough about him. We had such a great team at Children's in Wisconsin Children's Hospital. When you come into this sort of this, when your child is sick, you just can't imagine, you need to be able to trust the people that you're working with. And we were lucky enough to have a great team at Children's.
Can I
so now
ask
look
you,
at I'm
can I ask you, Carol, how far away was the Children's Hospital from where you live?
That's funny that you asked that, because in the book I actually have a part of a chapter that talks about all the different blessings that we had along the way, and that was actually one of my subtopics, was the blessing of having the best medical care in our backyard. Franklin is so we're in Franklin, Wisconsin, which is all part of Milwaukee County.
Okay.
For those, I'm sure a lot of people aren't so familiar with Wisconsin, but Wauwatosa is where Children's Hospital is, but it's still in Milwaukee County. So we're literally like 15 minutes away.
Oh my God, that's
on the
wonderful.
expressway. So we were so lucky, because along the way we met folks who had to drive hours,
Yes.
to get to the hospital. And so that, every time you leave, it was so nerve-wracking, because you're going home again with your child and you don't know what to expect. At any moment you feel like you could have, the floor drop from under you, and knowing that we were so close was such a blessing. We were so fortunate to have such a great facility. Mm-hmm. Mm-hmm. We would end up doing some traveling. That was another part of our journey after the tumor kept growing back, right? So we call it like a recurrence, but technically it wasn't necessarily a recurrence. We would take out as much as we could. He had radiation. We would throw a little chemo at it in hopes to kind of keep it at bay. But as our luck would have it, each year the tumor grew back. And it would basically be in the same spot, but it was not good. So the more this happened, the more we knew this was Luka's particular subtype of ependymoma, because even in a category of these tumors, there's so many different variations. And
Oh, wow.
Of course, each person reacts differently to the different treatments.
Mm-hmm.
So they did a lot of study on this tumor. I didn't even keep it all in my brain, to be honest with you. It was too much. You
Yes,
never want to
absolutely.
know all of that medical information, and all you care about is, tell me, is this going to work for him or not?
Yes, exactly.
Better.
And how much of quality of life will he have,
Right. And that's the thing. And he as a, he was he just always such an active, energetic kid. He wasn't really he was not a couch potato. He was an outside boy. He loved to do everything that young boys would do outside in the mud, playing soccer, playing basketball, football, any sport, really. So we knew that it would kill him essentially anyways, if he couldn't do anything anymore, with his friends, with his sisters. So yeah, we definitely kept that in mind all along the way. But so now I'm getting a little bit sidetracked, but
it's okay. Was he able to get back into some of his activities after the different surgeries? Like, could he play soccer again?
He actually did. This kid, we would come to joke that he was good at brain surgery. He really was. Even coming out of the anesthesia and stuff, the first major surgery he had was right around his sister's birthday, and he was telling, as they were bringing him out, before we even got to see him, he was telling one of the doctors or the nurses that were with him that it was his sister's birthday. And sure enough, it really was his birthday. So they're like, well, he's
Wow.
passing those first neuro checks as he wakes up. He knows where he is. He knows what day it is. So it was fun that way. He liked to kind of impress his caregivers.
That's
But
great.
yeah, and he always did bounce back well from the surgeries, and we were able to get discharged and bring him back home. And because we did try an inpatient chemo, a pretty intensive chemo the first year or the first summer, the first few months, they were really hoping that it would help debulk the tumor in the beginning, and it didn't. So after that, we really didn't have a whole lot of hospital time being hooked up to chemotherapies because we knew that it wasn't going to help as much as it would have
Right.
probably hurt him. So so we, in that way, I mean, we were very fortunate that between these surgeries we could still do so much, and he still had the heart to things, he still had energy to do things, and he, most importantly, probably had the will to do it. He really didn't want to just sit around and feel sorry for himself. He never wanted attention for it. He just wanted to keep going, business as usual. Um, one of the funny stories, that when he first went back to school that first summer, so we did do chemo, so he lost all his hair. He was on steroids,
Wow.
so he was totally puffy, like you unrecognizable, like puffed up.
Hmm.
And he had a feeding tube in his nose. And so one day it was getting close to the start of school, and he heard Bob and I talking something about the girls starting school. And he said, well, what about me starting school? I'm starting school. And we kind of looked at each other and we thought, oh, buddy, you can't go to school like this. We thought maybe we would keep him home until the feeding tube at least came out, and, until he got a little bit stronger. But he didn't care what he looked like. It didn't seem to bother him. But, and you don't care, but I was a little worried at how the kids would react to him,
Yes.
because it was scary. It was not the same kid that they saw leave the June, that end of the year before,
Mhm.
that same June. So luckily we had really, really awesome people at our school, at our elementary school, and we had a nurse, a district nurse, who helped navigate this whole process of him coming back. And she actually met with his class before he came
Oh,
and
wow.
explained to him. They all knew that he was sick because it happened at the end of the year before, so they all knew he had a brain tumor. But she explained to them how he was going to look, some of the deficits that he had, that he was going to have to be careful, that he had no hair, he had big scars on his head. And they were awesome. They were wonderful. I
That
was
is so
so
great.
amazed. And they were now second graders, and he just came in there like, what? Like nothing was wrong with him.
Yeah, yeah.
He
I'm
was,
back.
yeah, what are you looking at? I'm fine.
Yeah.
And that's kind of how he was. He just he never wanted to stay home from school more than he had to. So he wanted to be back into the business of things, get me back. So that year he did actually end up playing soccer again. He played a little bit that spring, that fall. But then unfortunately the next year when the growth came back, it happened again right at the beginning of a season. So
Mm.
at that point, then he didn't go back. Only just, maybe for a practice here or there if he wanted to run with the kids a little bit, but not as part of the team. So
Right.
unfortunately, his soccer career did end, but he took up golf. So
That's
this is
funny.
the kind of kid that would find the next thing, and he would look stuff up and be like, okay, maybe I should try this,
Yeah, maybe
so
I
he
could
took
do
up golf.
this.
And
Yeah.
mhm. And so Bob loved to golf, and so he was more than happy to get him some clubs and teach him how to golf. And they that was something that they did up until close to the very end. So
Oh,
that was Luca's spirit. If he couldn't do one thing, he just kept going. He would find the next thing that he could, that could entertain him, that could fill his time, that could challenge him. He liked to, he would sometimes even say, I have to keep my brain sharp. I can't just, sit here and do nothing. I have to keep my brain sharp. So
that's
I
really nice. And I was going to say that it must have been some wonderful times for your husband to bond with him. You
oh my
know?
gosh, it, I can't give Bob enough credit, for how much he did. even before Luka was sick, I mean, they were guys, right? They did stuff together. The girls, not we all did stuff together, and the girls and I did things, but there was just a special bond, and they did so much together. And once Luka got sick, I think that was Bob's mission, was to give him as many experiences as he possibly could, and
Oh,
not just that, but to have us all have that, the experiences together, and have the time. We traveled as much as we could. We just packed the kids up in our truck, and we would take road trips, on spring breaks and things. And anytime he was feeling good, we tried to make the most of the time. But yeah, Bob definitely did more probably with his son in his 11 years than some people do in their whole lifetime,
yes.
and that is a gift that we had, knowing that our time was likely limited. Of course, we always hoped for a miracle, and we were always hoping that the next surgery would bring us a miraculous cure, and we also tried alternative medicines. We tried all kinds of things. We didn't want to leave any stone unturned. We wanted to know that we threw everything at Luka as much as he would want, as much as he tolerated. But I think knowing, we were blessed with the time, knowing, that we did as much together as a family in the time that we had. And what a blessing. What a blessing that is, for sure.
It's a great feeling to know that you don't have any regrets about that.
Yep. Yep.
Wonderful.
And, yeah, because life has too many questions. As parents, we question everything we do with our kids, right? I mean, it's what
just the
you
way
do,
it is.
because you want to keep them healthy, you want to keep them safe. And there are some times when you just can't, and that sucks. It really, to be blunt, that just plain,
It does.
it's terrible. But by the grace of God, we still sit here and persevere. And that is definitely something I learned from this boy of mine. He did not give up. And I always think in the back of my head, he'd be disappointed in me if I did. So I better not.
And tell me about your girls. How did they deal with all of this when he was ill?
Just like what I said about Bob, I'm so proud of my girls. Sorry. Oh, when he was ill. Yeah, they were so patient and so understanding. They could have, and they were teenagers. That, like I said, when he got sick, they were fifth and sixth grade. Mara was just leaving the elementary school, going into middle school. Those are odd years, tough years for girls, as it is.
Yeah.
Much less to have a little brother who's dealing with cancer and a brain tumor. And they were steadfast as well. They kind of followed his lead. They kept to their studies. Their grades never dipped. They didn't look for excuses to not do their things, because they could have easily gotten out of a lot of things just saying, well,
sure,
my brother's sick. I mean, they could have used that as an excuse. They really didn't. I have to give them so much credit. And Bob and I remember specifically sitting down at one point shortly after Luka was diagnosed and saying, we need to do whatever possible to keep their lives as normal as possible. And we were fortunate to have family and friends close by that jumped in to help us, whether it was taking them to their practices for their sports and things, just to not have them miss things. We didn't want them to resent Luka either, for them losing their childhood, them losing, we didn't know how many years this was going to go on for.
Sure.
And, that was another thing I think that kept me going, was they need to know that their mom is also still here for them. It just because, not just because that sounds flippant, but they need me too. They need us too. They need to still have their lives as much as possible. I didn't want them to look back at this and resent their brother in any way. They knew it wasn't his fault. They know that nobody was making these choices, but they're kids.
Yeah.
They were kids. And of course that's just going to be a natural feeling, but they really never verbalized that. If they did feel those things, they never threw it at us. They never threw it at Luka. They were so great. And they all throughout, they tried to spend as much time with him as they could, in whatever capacity, whether it was at the hospital when he was there, or just home. They would try to do things to keep him busy, as much as possible when he was, especially as he was able to do less and less of his own
Sure.
activities. But they're really great. Things could have gone, way worse with the
Yes.
girls. I always tell people, they could have been angry. They could have really struggled with so many different things, but they stayed true to who they were, and they stuck to their activities. They didn't give up on things that they wanted to do, and they succeeded. They're now doing really well in college. Mara is a junior, and she's studying business, hospital administration,
Oh,
and she was on a
wow.
pre PT, pre physical therapy track. We're not sure if that's still going to be what she's going to do, but she wants to do something in the hospital world, which I think is
That's
pretty cool.
wonderful.
And Nina wants to be a child life specialist.
Oh,
Um,
wow.
and that is something very, very specific, and very much, we only knew what that was because of the time we spent at Children's. So because child life specialists tried to keep her busy and her brother busy, and so that's now what she wants to do, and she's very involved. She's volunteering at Children's Hospital right now, weekly. She drives
Wow.
in from school to do that. So it's a very cool thing. They're both, carrying out, I think, some of their brother's spirit, and wanting to help, and they're not afraid to use their story to now go forward, and use that to, to affect, to contribute to their futures as well.
And to so many
So,
other people that are going to be blessed by their stories.
oh, that's our hope. That is what, just could make me want to cry right now, because I really think that, I mean, we have something to back up our talk, right? We know how it feels. Um, we know what people might need or not need, and you just I think, like we said in the beginning, you just have a different empathy and a different way to hopefully, connect with people, that is very, very sincere, very genuine.
I agree. And for them to have gone through that, the death of their brother so early in their life, I mean,
Mhm.
it's not
Yeah.
easy, and
No.
everybody is always worried about the parents, right? And
Hmm.
and it was wonderful of both of you and your husband, to really truly understand that they had needs too, that they needed to, be taken care of and shepherded,
Right.
through their grief. Because unfortunately, I find that too many siblings are not taken care of,
Mhm.
when a parent or a sibling dies, when a
Yeah.
child.
Yeah. Yeah.
So they go through feeling like they don't have a right to their grief. And it was really great to know that you did so much to make sure that they knew they were entitled to their grief, and you worked with
Absolutely.
them.
Absolutely.
I
They,
commend
as a matter
you.
of fact, thank you. I really do feel like, I don't like to take all the credit. I feel like God gave me a purpose, and he really did help me, navigate this whole process. And I think he gave me some of that insight to make sure that I didn't lose sight of our whole picture.
Right.
Not, it wasn't just about Luka. It wasn't just about me and my grief and my feelings and my anxieties. I had a lot to work through, but having everybody else so close, and having them to worry about, takes a little away from yourself. And that's a good thing sometimes, when you need to put other people in front of you to keep going, to give you a reason to keep going.
Yes.
And they were definitely that for me. And I did ask them, to each write a little chapter in the book. So at the end of the book, I have sisters' perspectives, so they each wrote kind of a little account of their perspective of living with, a sibling with cancer, and then living with a sibling who passed. So they have beautiful little parts
That's
in my book
wonderful.
as well. Mm-hmm. I wanted
And
them, like you said, I wanted to give them a voice as well to share
yes,
their side of it.
definitely.
Mm-hmm.
So tell us how he came to pass. How old was he? He was 11, right?
He was 11. Yep. So the last year of his life, we took while he was, well, we had 2 trips to Croatia as a family.
Mm.
The year before he was sick, we traveled with our Croatian group that I kind of mentioned. We went the year before he was sick, and then there was another opportunity to go in 2018, which is when he passed away. So the beginning of that year, we had done what we decided with our medical team was going to be the last surgery, like the last time that we tried to resect a tumor, because there's only so much a brain can take, and there's only so much even just that the tissue where we kept having to go in could take without healing starting to be affected, and things going south that way. So we knew that this was going to be our last chance. So that being said, we tried another. We had the surgery. It was January 1st of 2018, actually New Year's Day, and then we tried a
Wow.
couple other oral chemo meds. That's just how it played out, because he got sick right after Christmas, and then that's just when everything played out. It was very strange. We spent New Year's Eve in the hospital
Wow.
with tooting our horns and hats and everything. And he had surgery the next day. But we took him to Croatia
That's
that last
great.
year. And I look back at that and think, oh my gosh, I hated to go up north if one of them had a virus, was sick with the sniffles or something. I thought we were going to be too far away from society. But we took him to Croatia. We took medications. We gave him shots
Did you
to
bring the
help boost
girls
his.
too? Was it like a family
Oh
thing?
yeah, oh yeah, oh yes, all of us did, and the
And do
girls were
you have
participating.
and do you have family that are still there, like your
We
grandparents
do.
or Oh, that's
Not
great.
that close. Well, actually, Bob did. They passed on by now, but we do have aunts and uncles and cousins still there on both of our sides.
That's
Hmm.
great.
So it was a very cool. It was a good experience. We're happy that we went. Some parts were tough, and he wasn't feeling the greatest. And like I said, looking back at it, I think, oh, we were crazy. But we had a mission. We had a mission to go, and one of the places we wanted to go to was Medjugorje. I'm not sure if you have ever heard of that. It's a very holy place in
Yes, yes, I
uh,
have
where Blessed Mother has appeared.
appeared.
It started years ago with to children. She was appearing to children, and now they're grown adults, and some of them still have the visions. But many healings happen there, and we thought, well, let's
Right.
see if we can take a little trip there, and if nothing else, get some extra blessings. And again, we're leaving no stone unturned. So our doctor, I think at first they thought we were a little nuts, thinking, I
But
don't know that
after you've been through so much, you probably thought to yourself, what do we have to lose, right?
I mean, I kind of, I don't know what we were thinking, to be honest with you, but yeah, I think we wanted to have that last experience, and he really wanted to go. We didn't want the girls to miss out on again on the trip that they had worked hard. They were part of the group that was touring, and they were going to performing there. So, but we didn't also want to leave half of us home, so we were like, it's all or nothing, and we have to go. So our doctor gave us the tools. He actually gave us his cell. He was awesome. He gave us our oncologist. He gave us his cell number, just if we
Wow.
had any questions that we needed to be, if we would need something, he'd be able to send us somewhere, So it was great, and it turned out to be, thank God, fine. And then by the time we came home after that summer, Luka started to decline much more. He was much more weak. We needed to get a wheelchair. He first started with a walker. Hated it. Hated to have to not be able to walk and to feel so weak. But he knew it. Walking any distance it was too tiring for him, and it was getting difficult. So we ended up getting a wheelchair, and in general, he was just becoming more weak. And so we knew it was a matter of time. And like I said, we were at this point just doing oral chemos and basically just keeping him comfortable and keeping him, as pain free as possible.
Right.
Um, he still was doing pretty well, and we got to he at that fall we decided, and he helped us make the decision. He wasn't going to go back to school. We were going to homeschool, and of course we knew that homeschool just meant doing whatever online that interested him. And
Right.
so we came up with a curriculum, and the teachers were at school were still so helpful, and were willing to do anything that we needed them to do for us. So we kind of did online schooling. uh, and we got him a guitar. He wanted to learn guitar at the end there, so we we picked out a guitar for him, and he would, like I said, he just still always wanted to challenge himself, give himself something new to look forward to. So we tried to fulfill those wishes for him along the way, um, as he got weaker and could do less of his normal activities. So anyway, we got to the holidays, and he was doing okay. Christmas Day, we celebrated Christmas. We did our celebrations on Christmas Eve, Christmas Day, um, and then literally it was the day after Christmas. Um, he was playing. One of his cousins was over, and they were playing a video game, and all of a sudden Luka just did not feel good at all. And so he went into our room on the first level, and he called me in, and he said, "Mom, I don't feel good. I can't breathe. It hurts." He was telling me that his back hurt really bad, his head hurt, and he was almost in a panic. And um, we had a hospice nurse by this time. We had visiting nurses so we called her, and she came to check on him, and he had developed pneumonia. So looking back, I think it was aspiration pneumonia. His swallow, because he was getting so weak. I believe that he probably aspirated, and then
Right.
that was caused the pneumonia. So, but at that point, after taking his vitals and everything and kind of looking at him, she said, "I don't know if his body's going to be strong enough to fight this." And so they weren't even going to bring in, she had contacted the doctors and kind of decided, we don't even need to take him in to get an x-ray. We'll just treat the pneumonia as it
Hmm.
is. Um, but really, he took a turn for faith. We kept him home. We had talked earlier about whether or not he wanted to be at home or go to the hospital. And those are really odd, terrible, awful conversations to have. And it wasn't until kind of the very end where we sort of did talk through that with him and the girls again, and we all decided that probably the hospital might be better. We would just all feel a little bit more comfortable. But Luca wanted to be home. And as it happened, how quickly everything happened, we really didn't even have time, nor did we feel it was worth uh, disrupting his comfort. Right? He was home. We were all around. Family came to see him, um, and it was a very peaceful passing, and so quick. I mean, he went literally from being out with family on Christmas, to 2 days later, 3 days later, passing away.
Wow.
Uh, it again, we look back at that and think, gosh, I've heard other stories, talked to other moms who watched their child decline over months, maybe a year, so slowly and so painfully. And for Luca, it was pretty quick. He wasn't in pain for a long time at all, and
Hmm.
just feel blessed for that, for sure. And the girls were home. It was Christmas break. They weren't having to worry about getting up and going to school and wondering, or us thinking, are we sending them to school and they may never see their brother again? So
Right.
we didn't have to
Exactly.
make any of those decisions. It just happened that quickly. So we were very fortunate that way. And it feels funny to say you're fortunate that your child died in the way he did, but really it was such a blessing, because we didn't have to make so many decisions and choices. They just sort of happened. And it was very peaceful, and he was comfortable, and he was with us. And I guess there's, I can't really ask for more than that, but it was the hardest thing ever, for sure. But we're learning. We have learned. We've worked through so much pain and anger. As much as I talk about God and my belief and my strong belief, trust me, I had strong words with the man upstairs. I was not.
I can appreciate that.
Yeah, I'd have definitely moments all throughout where I was like, begging for this to turn around and change. But afterwards, I would say there was a period of time I couldn't pray. I couldn't ask for God for anything. I was angry. I was thinking, what's the use? I've asked for, a break of this, and we never got a break. It was relentless. The tumor kept growing and growing, and we didn't ever have a nice stretch of time, right? That we didn't have growth. We didn't have more than a year. But I when it so there, it took me, I think, well, until the third year, where I think my heart started to sort of soften. That's when I started the book. I talk a lot in the book too about how, you go through phases. That first year, you're angry, but everything's still so raw, right? So you're his empty chair at the table, his empty, no stocking to fill, no birthday present to buy, like all those firsts. They're so raw, but still seem so surreal. It still doesn't seem real. You still think you're in a bad dream.
Right. Well, you're dealing with shock. You're in shock, and, and so you almost feel like you're in a bubble, and when the bubble starts to dissipate, that's when the real grief kicks in. I agree totally. That's what I talk about. The second year, I feel like being worse. Yes. Because all of a sudden it feels more real. Yes. It feels like this isn't changing. We're doing this. Like I have to deal with this now forever.
Yeah.
Right.
Yeah, for sure. I totally agree with that. Mm-hmm. And I have talked to other moms since that have lost their kids, and everybody seems to sort of agree that, and then it's frustrating, right? Because you're expecting yourself to get better. It's getting worse. And then you're fearful that, is this how it's going to be? Is it just going to continue to get worse and not get better? Right. Am I never going to be happy again? Am I never allowed to smile again, laugh again? Right. Right. Find joy in things. Right. But I would like to say, I'm here to say, hang in there. Hang in there. You will. Right. I mean, we're proof of that. And, I think, like I always say, you have to give yourself those moments, give yourself that space to still grieve whenever you need to still feel those feelings of loss, and to remember child and feel them, but always come back and give it your all to make the next day a better day, and keep moving forward. I believe our kids want us to do that. I 100% believe they don't want us to be sad for them. Luka told me so much. Did he? That was right when we kind of, this almost could be a nice wrap up. He when we decided, again, kind of with him in so many words, that there was no more treatment to be tried, that wouldn't, because he pretty much told us, if I'm going to go through things that are going to make me feel worse, that are going to take more of my ability away and still not cure me, why? Yeah. It's not worth it. He told us that. So we had a great day at our state fair. We had, and we came home. We were all tired. He was on the couch with his iPad, and he was researching some of the other chemos that we were looking at, unbeknownst to us. He found a paper that we had. This was our kid. He was very resourceful, and he was curious. He was looking up some of the chemos, and that's when he told us that, like, these are terrible. There's more bad side effects than there is good. And this is an 11-year-old kid.
That's amazing, isn't it? When you think about it.
he really was wise beyond his years. I think he packed in a lot, like we got a lot given to us in that short amount of time to make up for well, it's never going to make up for what we aren't getting, but it,
Yes.
um, so
In
anyway,
the
I went to
strangest
sleep.
way, he had a very full life. Would you say
Yeah.
that?
Yes. Yes, for sure. For sure. We always thought, even when he was little, before he was sick, we always thought he was sort of an old soul. He did have a great way to connect with older folks, and they loved talking to him, and he would sit and talk with older folks, just as easily as he would talk to his peers. I think he preferred people a little bit older than him, actually. But so anyway, that night after he had done this research, we're taking him to sleep, and I laid down with him and we were talking, and he started sort of talking about what he will do, with what he will be when he grows up, what he will study and all this. And I think he was sort of feeling me out. I think because he still talked about the future, but yet he knew that wasn't going to happen. Like like I said, it was such a strange thing, because you had these conversations, but you didn't say things out loud, but yet we somehow knew, right?
Mm-hmm.
And so anyway, he starts talking about this, and I can't hold it in. I'm crying. And I'm laying there with him, and he knows I'm crying. And he says, and he hugs me tighter, and he says, "Mom, I'm going to be okay. No matter what, I'm going to be okay."
Oh my God.
He knew he had such faith that he was going to be in a better place, and so then I'm crying harder, and he says, "Mom, I just want you to be okay. I need to know you're going to be okay." I said, "I want you to still be happy." And I was like, "Oh, buddy, I don't know if I can promise you that right now, but I will try." And
Mm-hmm.
then he said, I'll still be able to see you. I'll still be able to say hi to you. And I was like, "What?" And he said, "It might not be me, but I might be an animal. I might be a dog or a bird." And I was like, he said, "I'll still be able to see you and say hi to you sometimes."
Wow.
So we sort of like, okay, so we sort of left it at that, but uh, he does. He does. And I talk a lot about that in the book, signs that I get from this kid. I have such strong feelings sometimes. It started with a bunny in Arizona on a spring break that I encountered on a walk, when I was on a walk one early morning. And I had such a strange sense that this bunny in the desert was Luka. And he was just, I was able to get so close to it and take pictures of it. And I was talking to this bunny, and I'm crying because it was only a few months after he passed away. And luckily nobody else was around to see me, because they would have thought, "What is this lady doing with this rabbit?" But I couldn't walk away from it. I couldn't walk away from it. And I finally said something like, "Luka, you got to go, because I'm going to stay here the whole day, and Dad's going to wonder where I am." And then the bunny eventually hopped away. But since then we've had more bunnies in our yard than we ever did living in this house. And
Oh,
and they just
wow.
appear. Yeah, and there's different types of signs that we see, but I'm telling you, I do believe that God's letting us keep that connection, and he's letting us keep that Luca's spirit close to us. And I think the girls and Bob in the beginning thought I was a little losing it. "Oh boy, CarolAnn. Oh, CarolAnn, what's going on?" But now they see the bunnies, and they will tell me, "Mom, I was walking to class, and I was about to take an exam, and I saw a bunny. I think it was Luka giving me good luck, or so he's
It can
sharing the
be
love
really
with all of us.
comforting. All those kind of
Oh,
signs. Oh my God, they can be
mhm.
so comforting. We used to have a
Yes.
situation where we had a little music box on our in our living room, and it had a picture of the first rose that her father had ever given me.
Uh-huh.
And I never touched that music box. Okay. I never touched the music box, and it was very small. And all of a sudden, we'd be having dinner one night, and there it starts playing out of nowhere. And I was like,
Yeah.
"Hi, Angela."
Yeah.
It's just that's
Yeah.
what
I
happened.
think, yep, it's beautiful. It's a beautiful thing. I think when you have a strong connection like you do with your children, what a blessing, right? I think it's them telling us they're okay, and they are still with us, and they want us to be okay.
I think so too.
But
And because our faith believes in, something more than just here.
Mhm.
I
Yeah.
really do believe that, they're waiting for us, they're
I
there.
do too.
And from all the books I've read and people I've known who have told me, that
Mhm.
they've gone to heaven and God said, no, not yet, and they come back,
Mhm.
but their family is always waiting for them at the end of the light.
Right.
I love that.
Right.
You can't have that many people tell you the same story and not
I
believe.
agree. I agree. I read a lot of books too after. I think that was one thing that I did that really helped me in the beginning, when I didn't really want to talk to people, you didn't want to
Yep.
hear everybody's advice, but I read a lot, a lot of things on heaven, a lot of things about signs and kind of just needing that reassurance
Yep.
that it, like you said, hearing other people's stories and wanting to believe that so badly. And you want to always know where your kids are. You want that text saying, I arrived. I'm okay, mom.
Yes.
And we don't necessarily get that the normal way, but I think I read so much looking for that, to be open to the signs and to be open to those little messages of saying, I'm okay.
Yes.
I've arrived. I'm okay. I'll see you again. You're there's going to be time in between, and I think when we first met, we talked a little bit about whether or not you're afraid to die, whether or not you're, if this changes that. I think Luka's faith and his strong belief that he was going to be okay, that he knew he was going somewhere better, right? He knew there was more than this life here. And how would he know that? I don't know. How would he have such a strong sense? And I now have a greater belief too. It reaffirmed my faith. And um, now that's what I look forward to. And I think, well, this kid's waiting for us. He knew, and I'm not going to rush the rest of my life. There's
Sure.
still so many things I want to do with the girls. I want to see how their lives and their careers play out. I'm so excited for them, and I want to be part of that, and love to be a grandma someday, all those great things. And I don't want to rush any of that, but at the same time, I guess when it is my time, I'm not fearful of it.
Yes.
And you sort of do learn to kind of, you give that up. It's
Mhm.
whenever God calls us, and
Yeah.
we do learn that hard lesson of not my will, but
But his
yours be
will be
done.
done.
So,
Right.
hmm
Yeah.
hmm
And what is that saying? When we make all our plans, God laughs.
yeah,
Right?
yeah, right, yeah, for
I
sure.
try to remind myself of that because, I'm just a
Yes.
planner.
Yeah.
And then,
No, isn't that funny? I do think, like, sometimes I stop and say to myself, CarolAnn, if you didn't learn by now that you can't control these situations, then it's not up to you. If you
yep,
still don't know that, something's wrong with you.
I know.
But we have to remind ourselves, because we still, we're still human, right?
Yes, we are. And control is one of the things, especially through the grieving process, that is very aggravating
Yes.
because you want to be able to, you know, deal with all that comes. You want to be able to make the decisions to make yourself feel better or do things or not do things. And, there are just days you get up and you can't barely get out of bed, and then
Yeah.
there are other times where you're like, we're going to keep doing this. It might not
hmm
be pretty and
hmm
my face might be all puffy with red eyes, but I'm going to keep going because I don't really have a
Absolutely.
choice.
Right. Right. For sure. Yeah. I'm always curious. I like to talk to other moms to get their experiences and you know and maybe the reassurance that it's normal for us to have those days always. I
Yes.
mean, we will have those days. Everybody has those days, regardless of if they've been through what we've been through. But I feel like we may have them a little more often, and we may have them maybe a little differently. differently,
Right.
but exactly, we find a way to keep going, push through it, not push through it, I guess, but keep going,
Yes.
keep
Keep
going.
going. Even if it's not
Mhm.
perfect, it'll never be perfect. And
Right, right.
one day can be completely different than another. And no matter
Hmm.
how many things we have on our to-do list, there are just some days where we will not get through them.
Yep, yep, yes,
you know
yeah,
and
yeah. You don't have it.
we have to give ourselves the grace, right,
Yes,
to be
for sure.
able to let it go.
Yeah,
I find that hard. I really do. Even to this day,
it
I
is.
find it hard.
I do too. I do too. Another saying that I heard along the way, was that so you don't always wake up with 100% in the tank. So if you giving your 100%, only be 40, because if that's all you woke up with that day, but you're still giving it your all, you're still trying, you're still in it to
Right?
to do your best on that day. It may not always be 100%, and that's
Mhm.
okay, because it might have been your 100% that day. That's what you had.
Oh, that's a very good way to put it because that's what I was thinking. That's all I have. That's what I can do.
Mhm.
And I'm going to have to accept the fact that I'm not 100%
Yep.
and
Yep.
be okay with it,
Be
be
okay with
okay
it.
with it.
Right. Right.
CarolAnn, this has been wonderful. Thank you for sharing so
Thank
much of
you.
your journey and Luka. And please hold up your book. I want everyone to see your
Oh,
book.
yeah.
So, this is her beautiful book called Luka's Light, and you can get it on Amazon. And she also has a Facebook group or a Facebook
Yes.
page, I should say, right?
Hmm.
And
Hmm.
I'll put
Yes, a
all
public
that in.
page.
I'll put all those things, all those links in the show notes so that you can go and learn more about her, her son, and her family, and all the wonderful love and light that Luka brought to everyone's life.
Yeah, for sure. Thank you so much for the opportunity. I really, really appreciate it.
You're quite welcome. God bless.